I'm Joe Graydon.
I'm Terry Graydon. The People's Pharmacy podcast is brought to you in part by Squatty Potty, the original toilet step stool that creates healthy toilet posture. Learn how squatting relaxes the colon and allows for easy, healthy elimination at squattypotty.com.
And by Comfy, makers of all-natural buckwheat hull pillows. Comfy pillows provide superior support by conforming to your head and neck for healthy, restful sleep. On the web at comfycomfy.com. For 10% off your first order, enter the code PEOPLES at checkout. For decades, concussions were considered an unavoidable hazard of sports like football, lacrosse, and rugby. What's changed? This is the People's Pharmacy with Terry and Joe Graydon.
Head injuries can cause lasting scars in the brain where you can't see them. Even seemingly minor concussions may produce long-lasting harm. When thousands of football players successfully sued the NFL because it downplayed the dangers of concussions, Americans started paying more attention to brain injuries.
How vulnerable are children playing sports like soccer, football, or hockey? How could sports be changed to protect their heads better? What about other types of head injuries, such as car accidents or falls?
Coming up on the People's Pharmacy, the latest on diagnosing and treating head injuries.
First, this news.
In the People's Pharmacy health headlines, processed meats such as salami, bacon, hot dogs, or ham have been classified as human carcinogens, according to the International Agency for Research on Cancer. This branch of the World Health Organization also suggested that people who regularly eat red meat may be putting themselves at risk for prostate or pancreatic cancer.
This is not the first time that processed meat has been suspected of contributing to human cancer. The American Cancer Society tracked more than 184,000 volunteers between 1992 and 2009. They found that those who ate 10 servings a week of processed meats were at much higher risk of colon cancer than those who ate only 2 servings a week. The health professionals' follow-up study and the nurses' health study had previously found that people who ate processed meat nearly every day had a 20% higher risk of premature death, though the study did not specify if that death was primarily from cancer. It may be time to move bacon and prosciutto into the category of rare treats to be savored only sparingly.
Type 2 diabetes and non-alcoholic fatty liver disease are now being diagnosed in many children, possibly as a consequence of the obesity epidemic. Scientists have now discovered that removing much of the sugar from youngsters' diets, even if calories and weight stay the same, has remarkable benefits for their metabolic health. The 43 children in the study were 9 to 18 years old. They were obese and had high blood pressure and cholesterol, or fat accumulated in their livers. In this experiment, the kids got diets with the same amount of calories, just less sugar from soft drinks and sweets. There were no health foods, but there were low-sugar versions of junk food, such as baked potato chips, pizza, and turkey hot dogs. During the intervention, sugar made up only about 10% of the calories in their diets, compared to about 28% before the study began.
Over 10 days, triglycerides, blood pressure, and LDL cholesterol dropped significantly. Both blood sugar and insulin were lower as well. Some of the youngsters did lose weight because they didn't feel hungry enough to eat all the food they'd been given. But even the kids who lost no weight had metabolic benefits. This study demonstrates the damaging effects of sugar, especially fructose, on children's diets.
Acid-suppressing drugs called proton pump inhibitors, or PPIs, are considered so safe that they can now be purchased over the counter as Nexium, Prevacid, or Prilosec. House brands include esomeprazole, lansoprazole, and omeprazole. 2 new studies indicate that regular use of such medications can increase the likelihood of developing chronic kidney disease. This is just the latest in a long list of serious complications associated with PPIs. Problems such as pneumonia, intestinal infections with C. diff bacteria, an increased risk of weakened bones and fractures, and a greater propensity for heart attacks makes one wonder whether the benefits of these heartburn medicines outweigh the risks.
Doctors often adopt a don't mess with success approach when treating hypertension or type 2 diabetes. What's meant by that, though, is a numbers game. If intensive drug treatment gets blood sugar or blood pressure to a predefined target number, health professionals often believe they've accomplished something good for the patient. Many are not aware of the potential harms of overtreatment.
A study of more than 200,000 older patients treated through the U.S. Veterans Health Administration in 2012 found that it was fairly uncommon for doctors to reduce doses of blood pressure or diabetes medication, even in those whose treatment had resulted in low blood sugar or blood pressure. About 38% of those treated for hypertension had very low blood pressure, under 120/65, as a result. In the course of the year, about 19% of these patients had their medications adjusted to be less intense. Those patients with low levels of HbA1c, a measure of blood sugar over time, fared a little bit better. 27% of them underwent an adjustment of medication. This shows, however, that it is difficult for doctors to consider backing off on medicines, even if the treatment may be too aggressive. Perhaps it's time for healthcare providers to pay more attention to the risks of overtreatment. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Concussions are a silent epidemic, misunderstood and underdiagnosed. For decades, athletes who suffered a blow to the head were encouraged to get back in the game as quickly as possible, whether they were playing football, rugby, lacrosse, hockey, or soccer.
Well, a concussion doesn't have to be the result of a sports injury. Concussions can also occur as a result of an automobile or bicycle accident, a fall, or just running into something. What can we do to recognize concussions and better understand the damage they can do? How can they be prevented?
To help us understand what we can do individually and as a society to keep concussions from ruining lives, we turn to two leading experts in this field. Dr. Alan Finkel is co-founder and partner of the Carolina Headache Institute and immediate past chair of the post-traumatic headache section of the American Headache Society. He is contractor for the Defense and Veteran Brain Injury Center at Fort Bragg. Welcome to the People's Pharmacy, Dr. Finkel.
Thank you so much for having me.
We're also talking today with Dr. Kevin Guskowitz. He's Keenan Distinguished Professor in the Department of Exercise and Sports Science at the University of North Carolina at Chapel Hill, where he was just named Dean of the College of Arts and Sciences. Dr. Guskowitz is co-director of the Matthew Gefeller Sport-Related Traumatic Brain Injury Research Center and director of the Center for the Study of Retired Athletes. He has served on the NCAA Concussion Committee and the NFL Head, Neck, and Spine Committee. Welcome to the People's Pharmacy, Dr. Guskowitz.
It's a pleasure to be here.
And we invite you to join the conversation. Do you have questions about concussions? Have you suffered from a concussion yourself? You can give us a call at 888-472-3366. We're also at radio@peoplespharmacy.com for your email messages or via Twitter at People's Pharmacy. The number again, 888-472-3366.
Dr. Finkel, can you start us off by telling us what is a concussion?
I knew you were going to ask that question. A concussion, the way that I perceive it, is a clinical event, not just an event that occurs. The most common concussions in America are actually slip and fall. The most interesting concussions are sports, and in my work in the Department of Defense, those that occurred during the global war on terrorism. But it's a blow to the head that has specific definitions, including how much loss of consciousness you might have had, which would be a period of unawareness or even amnesia, not being aware.
Now, if a person is not actually unconscious, if they haven't been, quote-unquote, knocked out, does that mean it's not a concussion?
Yeah, I think that Kevin can speak to this as well, that all of us know of our own children or those others that we've watched at a soccer game on a Saturday who come out and say, what happened? And they continued to play throughout the whole period.
Sure, and I think it's important to recognize that in sport-related concussion, less than 10% actually involve a loss of consciousness, and less than 25% involve any memory impairment. So there are many other signs and symptoms, such as concentration problems, dizziness, blurred vision, that we look for in these athletes.
So when you watch a football game, college football or professional athletes, the NFL on Sunday, and you see somebody, as they like to say, has had his bell rung, but they don't seem to have actually passed out, they could still have had a concussion.
Absolutely, and we actually have tried very hard to eliminate the word bell ringer or had their a ding, because it trivializes the injury, and coaches used to love that language because it suggested that the athlete could just go right back in and play. So we're really calling these brain injuries.
And you're saying that getting right back up and going back to play is perhaps not in the person's best interests.
That's correct. It could prolong their symptoms and also could be catastrophic in rare events.
Dr. Finkel, why is it that concussions are so underdiagnosed or perhaps even underappreciated?
Again, an excellent question about the person who is injured. I think the athlete may have a stake in not claiming. A soldier may also have the same stake in order to continue. And even an individual on the flip side of that, what has been classically called workers' compensation neurosis, there may be incentives on both sides to overemphasize or underemphasize, and I think that biases the clinician and evaluator with our own particular biases. We may take a young student who's a soccer player and want her, unconsciously perhaps, to continue to play and underplay it. But the work that Dr. Guskowitz has done, and I think the comprehensive evaluations of the athlete and soldier specifically, not the civilian as much, in the moment of contact or very close, I think has really changed the game.
Tell us a little bit about how that evaluation should be conducted. How is a concussion diagnosed?
Well, you mentioned earlier that this can be a hidden injury or silent epidemic. I tell people their concussions are sort of like snowflakes. There are no two alike, so we try not to use a cookbook. But we do focus in on trying to not only talk to the individual about the signs, the symptoms they're experiencing, but also to find ways to objectively assess their cognitive function, which involves memory, concentration, attention. We have some tools that we can use to do that. Likewise, balance assessments are really important to look at the motor side of brain function.
Now, this isn't just a result of a sports injury. I mean, you can be rear-ended and have whiplash and feel like maybe everything's just fine. You didn't lose consciousness. But that can also lead to a concussion.
I think one of the things, again, that we've all learned is that the forces involved in the movement of the head are more important than necessarily having a direct injury to the head. And the fancy term of acceleration of the head occurs when you're rear-ended at 10 miles an hour. And as I talk with my patients who've been in these, back in the day when we were young, we didn't have seat belts. So you hit the windshield. But now, because of seatbelts and also headrests, there are forces that occur that the muscles of the neck actually bring your head backwards. So you accelerate, you decelerate, and then the brain inside the skull moves around. And really important in all of these injuries also is the angle. Being hit from the side is different from being hit from the front.
You're listening to neurologist Alan Finkel of the Carolina Headache Institute. We're also talking with Dr. Kevin Guskowitz, Keenan Distinguished Professor of Exercise and Sports Science at the University of North Carolina at Chapel Hill.
Our lines are open for your questions and stories about concussions. You can join the conversation at 888-472-3366. Now, you mentioned the idea that there's a rapid acceleration and deceleration, or basically your brain is sloshing around inside your skull. I'm assuming that's not a good thing. if it happens really fast and really hard.
And I think what we have to recognize is that even you could be hit to the front of the head, but it could be that the damage is on the side or in the back, and the sloshing around that takes place causes a stretching and a shearing of the neurons within the brain, of which there are millions of neurons within the brain. And so it's that disruption that might cause, if it's in the memory center of the brain, it might cause a memory impairment, or if it's in the motor cortex, it may involve challenges with gait or balance. And so it's very unpredictable.
So despite being millions of neurons, they are not expendable. We're going to go to the phones. Charles in Chapel Hill, welcome to the People's Pharmacy. Your story.
Hello. When I was 15, and I'm now 68, when I was 15, I fell off the back of a motorcycle, hit my head, and was unconscious for 3 days. And have always wondered, if the brain could heal itself, if mine specifically could heal itself, and am I at higher risk for Alzheimer's or other dementias?
Great question, Charles.
That kind of stuff. Okay.
Thank you for the call.
Excellent question, because you embedded it in our two very important concerns. One, which is more of what I do. What do I do when I see somebody who may say 3 or 4 years ago I slipped and fell, or I had an injury of some sort to my head and I still have symptoms? But I think the person who's had an injury 30 or 40 years ago actually presents a very, very different picture, and the evaluations which I do, though similar, bring into account things like memory and cognitive function. And as I always like to say, I raised 3 boys, and watching them learn to walk was an exercise in how come they don't get concussions every time they fall down and hit their head. And then the other really brings up, I think, a very important point that, if there's time, I would certainly like Dr. Guskowitz to speak to that concern for Alzheimer's disease if a person has had an injury in their teens or 20s.
Dr. Guskowitz, we just have a little over a minute before the break. We have heard a lot from the NFL players about, this idea of Alzheimer's disease or some
dementia.
kind of dementia. Connection to all of those head injuries?
Well, there's a lot of debate on this topic right now, and I think that the big question that we're sort of chasing the answer for is it the previous concussions, such as in Charles' situation, and those added up 2, 3, 4 concussions? We know you're at an increased risk once you've had more than 3 concussions during your playing career for mild cognitive impairment, which is a precursor to Alzheimer's disease. You're also at an increased risk for depression after the age of 50 once you've had 3 or more. What we don't yet know is what does 7, 8, 10 years of exposure just to repetitive subconcussive impacts, those that don't necessarily cause a concussion, but they might add up. The pendulum seems to have swung toward this assumption that too will cause these same risks, but it has not. That has not been determined through scientific study yet.
You're listening to Dr. Kevin Guskowitz, Keenan Distinguished Professor of Exercise and Sports Science at the University of North Carolina at Chapel Hill. We're also talking to Dr. Alan Finkel, who works with the Defense and Veterans Brain Injury Center at Fort Bragg. We're going to take a short break. When we come back, we'll talk about sports and which sports put players at risk for head and brain injuries.
Are girls at risk of concussion as much as boys?
We welcome your calls, questions, stories about sports and head injuries at 888-472-3366. You can email us radio@peoplespharmacy.com or via Twitter @peoplespharmacy.
You're listening to the People's Pharmacy with Joe and Terry Graydon.
If you like the information you hear when you listen to the People's Pharmacy, you may also enjoy our book published by National Geographic. It's the People's Pharmacy Quick and Handy Home Remedies, available online at peoplespharmacy.com or at your favorite bookstore.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible by Redix Industries, makers of utterly smooth creams and lotions that moisturize deeply to make dry skin feel soft and smooth. The number's 800-345-7339, online at uttercream.com.
And by Squatty Potty, the original toilet footstool that creates healthy toilet posture. You can learn how squatting relaxes the colon and allows for easier, healthier elimination at squattypotty.com.
If you'd like to order a CD of this show, you can call 800-732-2334. Today's show is 1011, or visit our website, peoplespharmacy.com.
Today, we're talking about head injuries and damage to the brain that can occur as a result. Our guests are concussion experts. We're talking with Dr. Kevin Guskowitz, Keenan Distinguished Professor in the Department of Exercise and Sports Science at the University of North Carolina at Chapel Hill. He has served on the NCAA Concussion Committee and the NFL Head, Neck, and Spine Committee.
We're also talking with neurologist Dr. Alan Finkel. He's co-founder and partner of the Carolina Headache Institute and president and CEO of the Carolina Headache Foundation. He's a contractor for the Defense and Veterans Brain Injury Center in Fort Bragg, North Carolina.
We invite you to join the conversation at 888-472-3366. You can email us, radio@peoplespharmacy.com, or get in touch through Twitter. We're at People's Pharmacy. That number again, 888-472-3366. And we'll go right ahead and start with a call.
Hi, Bill in St. Petersburg, Florida. Welcome to the People's Pharmacy. Your story, please.
Hi, thank you. I'm a diving coach here in St. Petersburg, and I've taken several courses in concussion for coaches. My question is this. First, we're given the definition of a concussion as being a head trauma that results in a disruption to the normal function of the brain. Then they give us a series of tests to administer to an individual who may have suffered a head trauma. So my question is this. If this individual suffers head trauma and I administer the tests, where is the threshold? How many tests does he or she need to fail before I'm going to pull the kid out or call 911? Where are the various thresholds? They give us a test, but they really don't help us a lot with what do we do with the information that we get from giving the test?
Oh, thanks for that, Bill. Dr. Guskowitz?
Sure. Good question, Bill. And I would just say that anytime there's a suspected concussion, that's the point at which that athlete should be pulled from activity and to go through this extensive battery of tests, typically conducted by an athletic trainer or physician. And it's we want to test their memory, their all these symptoms. We have a 22-item symptom checklist. That's the starting point. Any symptoms that are showing up, that athlete should not be returning back to play. And then we would hold them certainly for that day and then evaluate them serially over the course of several days to see if they recover from that on these measures of cognitive function, balance, and symptoms. So oftentimes, depending on the age of the individual, this recovery period could last anywhere from 5 to 15 days, typically younger athletes taking a little longer to recover.
Of course, if it were the Super Bowl and it's the quarterback...
Shouldn't matter. Doesn't matter.
Okay.
We don't want to return an athlete while they're still symptomatic with the concussion.
All right. The CDC estimates that anywhere from 1.6 to 3.8 million concussions occur every year in the course of sports or recreational activities. And that may actually be an underestimate, since many people who suffer mild brain injuries may not get medical treatment. So I'm just wondering, Dr. Alan Finkel, are younger athletes more or less vulnerable to head injury and concussions than adults?
I don't know that I can give you the deep science on that. And because my particular area is headache, there's a growing body of data that really is showing that the kids have similar persistence of symptoms. Headache may be a leading edge symptom, but the other post-concussive symptoms, which Dr. Guskowitz alluded to, are more easily evaluable with, again, balance evaluation system, which, again, Dr. Guskowitz created, impact testing. But I would say to Bill that the most important thing as a trainer or as a coach is to recognize that the establishment of baselines before the sports seasons begin, and a lot of this has been mandated by state law, and it's, again, easiest in academics, but when you look at clubs, some of this is a little looser around the issue of training, especially where so many of our kids are being pushed and coddled into aggressive sports without necessarily doing the necessary baseline testing.
We also have an email from Anne who points out that not only sports but also other sorts of things can cause problems. Specifically, Anne is concerned about battered women. She says, I have suffered for years with vertigo, partial deafness, and other problems from being a battered woman. So we also want to acknowledge that that is another source of terrible injury.
I'd like to know about the symptoms of post-concussion syndrome. So somebody has a concussion, they're kept off the playing field for maybe a couple of days, maybe even a week. But what could be some of the other symptoms suggesting that things are still not quite right? Dr. Guskowitz?
Well, with post-concussion syndrome, and there are varying definitions of this, the one we tend to use in sport is when symptoms are persisting beyond about 3 weeks, because these are typically very healthy, active individuals, and and it's oftentimes this lingering headache that will sort of identify this individual. That those headaches then can drive other components or other symptoms, such as their sleep disorders, which is very common. They'll sometimes create vertigo and dizziness, problems experiencing with dizziness, and those are the ones that we begin to think about rehab. And Dr. Finkel and I were talking about this before the show started. That seems to be the next frontier in this area of concussion research, and that is identifying. We used to say that rest is best, and but now we're finding that probably thinking about doing something with them sooner might help them get out of this state of symptoms.
Now, we've heard the term cocooning. The idea that, okay, you've had a concussion, whether it's because of a fall or because you fell off your bicycle or because you played football too hard or maybe you banged your head against somebody else going up to head the ball in soccer. Just go home, rest, don't read, don't watch TV, get into your cocoon, and stay there for how long? And is that even good advice?
The controversy in youth and professional sports right now is raging because there is a question as to whether or not, and it's a psychological issue in a way, of enabling somebody's illness behaviors when in fact they may be getting better naturally. Again, I refer back to the Department of Defense and to DivBIC, my organization, because they've done a great deal to codify in theater, again, at war, the kinds of things that would expose a soldier or a Marine to danger. So we do cocoon them for 24 hours. They're retested very vigorously on a day-to-day basis until they return to that term I said before, the established baseline that then allows them to return to play, return to duty, and for our civilians, again, to return to activity.
Now, we have an email from Dr. Saul. He's a PhD at Stevens Point, Wisconsin, and he says, how effective is impact testing in sports on determining recovery from concussions? Dr. Guskowitz?
Well, I'm assuming that the impact testing he's referring to is one of the many platforms that are out there for computerized neuropsychological testing. It is one tool in the toolbox, as I tell individuals. It's useful for assessing the cognitive function, so memory, attention, concentration. And I think it is useful, and I think to Dr. Finkel's point, it's a useful tool to establish a baseline with, but don't just rely on that tool alone. Balance testing is really important, and tracking symptoms is equally important.
You're listening to Dr. Kevin Guskowitz, Keenan Distinguished Professor of Exercise and Sports Science at the University of North Carolina at Chapel Hill. We're also talking with Dr. Alan Finkel, who works with the Defense and Veterans Brain Injury Centers in Fort Bragg, North Carolina.
Our lines are open for your questions, your calls, your stories at 888-472-3366. You can email us at People's Pharmacy and Twitter, again, at People's Pharmacy. It's peoplespharmacy.com. We go to Lynchburg, Virginia.
Marcia, welcome to the People's Pharmacy. Tell us your story, please.
Hi, thanks so much. I just have a couple of quick points. Last year, my son was playing club soccer, suffered a concussion, and was 5 minutes after taken out of the game, asked by the coach if he was okay to play and put back in the game. My point is that we've got to continue to advocate for certified athletic trainers to be on the field for any sporting event. After my son's concussive event, I went on to work with our local physician and to actually present to the club soccer league here in my hometown about the very frightening fact that secondary concussive events can actually cause death. I think that if more parents were aware of this, they would be loath to engage their children in aggressive sport activities without this fail-safe measure. You know, coaches, as terrific as these people are, some of them are just not educated in exactly diagnosing these events. And you know, it's just very disconcerting as a parent.
Marcia, I'm just curious, how is your son doing?
Oh, my son is fantastic now. I've of course become, you know, a complete crazy parent, micromanager about this kind of stuff. And I will say though that he was put on complete bed rest for 2 solid weeks. Watching him fail the test that our local physician administered was one of the most frightening things I've ever gone through.
I can only imagine. Marcia, thank you so much for your call. Dr. Finkel?
Well, again, I appreciate the comments that you made, Marcia, especially where we're dealing with any individual who is not necessarily an expert-trained individual who's going to return somebody to play after a period of amnesia or unconsciousness. So that term, okay to play or okay to go, I think should be modified. And the CDC has lots of, and again, anybody's interested should go to cdc.gov, and there's wonderful tabs there that they can give to their coaches. There are cards, there are locker stickers that for the players to be aware. So the raising of awareness that's gone on as a result of the interest in concussion is, I think, very important to Marcia and other parents.
Dr. Finkel, Marcia suggested that a secondary event could actually be lethal. Is that true, or is it true but so rare as to not actually be worth considering?
It really is the latter in some ways. It comes from what was called the catastrophic second hit syndrome, in which a single case report was reported. And I think any person may have heard of somebody who did have a second hit and suffered a great deal of brain damage or even death. But I think it's extremely rare. But much like in my world of headache, every headache is not a brain tumor. Every concussion is not a setup for the next concussion to be fatal.
Of course, when you watch the NFL on Sunday, Dr. Guskowitz, and you see these linebackers getting hit time after time after time, it's a little scary.
It is, and we again, there have been rule modification that the NFL has put in place that the NCAA has followed up with. The kickoff rule was changed in 2010, and we've seen a reduction by nearly 50%.
What is that change?
They moved the kickoff line up to the 35-yard line as opposed to the 30, so we're seeing more touchbacks, fewer returned kicks. The second rule change there was that the kickoff team can only have a 5-yard running start as opposed to a 10-yard running start up to the line of scrimmage, which reduces the physics involved with those collisions.
Let's go back to the phones. Charlie in Augusta, welcome to the People's Pharmacy. What's this about soccer?
Hi, Terry. I want to know, I coached varsity level soccer when I was teaching, and I want to know what you guys think about the headers, because I think they're dangerous. Thank you.
Okay, heading the ball. As a soccer player myself in high school, we used to do a lot of heading. I mean, that was like, this is the way you can score goals. And sometimes when you watch, the World Cup, professional soccer players, and you watch them heading the ball, especially if it's been hit by the goalie, and travels a great distance and is very high, it seems like, wow, what's that doing to the brain? Dr. Guskowitz?
Well, I think the key there is making sure that if you're teaching heading, that you have somebody who knows how to do this, teaching kids how to head a ball properly. Also, the size and weight of the ball is really important. There are different size and weight balls for different age groups. And what we do know about concussion in soccer is that it's the rare event that it's actually the ball contacting the head that causes a concussion. It's more typically the head-to-head contact with two players going up to head the same ball. More recently, the data that just came out about 3 weeks ago suggesting that head-to-body contact, so elbows to the head, soccer's becoming a slightly more aggressive game, that's more likely to cause concussion than, again, head-to-ball contact.
Well, which sports have the highest rates of concussion?
Football is sort of traditionally has led the way. However, the NCAA's latest study from 2 months ago suggests that wrestling now is higher than that of football, and as is men's ice hockey and women's ice hockey, that they have the highest incidence rates. And I'll just add in there equestrian sports. I was in London last week for a conference, and there was a wonderful presentation by Michael Turner on this topic showing that in equestrian sports, the incidence is far greater when factoring in exposure, over 50 times that of football. But there are many fewer equestrian athletes, so we don't see the absolute numbers superseding that of football.
Well, when I look at those helmets that horseback riders use compared to, for example, the helmet that a football player uses, it's like there's a world of difference. How good are equestrian helmets at protecting the brain against a concussion?
Well, first of all, I think it's important to note that any helmet is designed really to prevent catastrophic injuries. So these skull fractures or these brain bleeds with second impact syndrome or swelling of the brain that we've talked about, they do help mitigate the forces to the brain to some extent. I'm not an expert on equestrian helmets. I know more about football and hockey helmets, but they're very good at doing what they're designed to do, and that is to prevent skull fractures and brain bleeds.
What about concussions, Dr. Finkel?
Again, what attracted me initially to trying to understand the patients who were coming to me from the military when I was over at UNC in the headache clinic was that some of them didn't even have contact. The signature injury from the recent wars has been explosions, and how an explosion can cause a concussion has taught us a great deal about helmets because they are blast-proof. Even the glasses and goggles are blast-proof. But we feel that the energy that's causing concussion actually can sneak up under the helmet and cause brain injury. So you add that to the issues of, such as in ice hockey, where you're seeing torquing of the head in these videos and not direct contact. So concussion is more complicated than just getting hit.
Well, what about people who are not wearing helmets, for example, cheerleaders?
I was at a sports conference for the Academy of Neurology this past summer, and it was presented that, again, much like the equestrians, it's the absolute number. So more head injuries that occur in cheerleaders result in concussion because many times they're not practicing in authorized areas.
And, of course, they're not wearing helmets. We're going to take a short break. When we come back, we're going to learn about the efforts being made on preventing concussions. We'll find out about what's the appropriate treatment. And if you'd like to join the conversation, please give us a call. The number's 888-472-3366. You can email us, radio@peoplespharmacy.com, or contact us via Twitter @peoplespharmacy. The number again, 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Redix Industries, makers of utterly smooth creams and lotions, helping dry, cracked skin feel utterly soft and smooth. The number's 800-345-7339, online at uttercream.com.
And by Squatty Potty, the original toilet footstool that creates healthy toilet posture. You can learn how squatting relaxes the colon and allows for easier, healthier elimination at squattypotty.com.
You can purchase a CD of this show. Just call 800-732-2334. Today's show is number 1011, or visit our website. It's peoplespharmacy.com.
We're talking today about head injuries and concussions. Our guest, Dr. Alan Finkel, was co-founder and partner of the Carolina, he still is partner, of the Carolina Headache Institute and immediate past chair of the post-traumatic headache section of the American Headache Society. He's a contractor for the Defense and Veteran Brain Injury Center at Fort Bragg, North Carolina.
Also in the studio with us is Dr. Kevin Guskowitz, Keenan Distinguished Professor in the Department of Exercise and Sports Science at the University of North Carolina at Chapel Hill. Dr. Guskowitz is co-director of the Matthew Gefeller Sport-Related Traumatic Brain Injury Research Center and director of the Center for the Study of Retired Athletes.
And you are welcome to join our conversation. If you have a question about concussions or a story to share, you can call 888-472-3366. You can also send us email, radio@peoplespharmacy.com, or send us a message through Twitter. We're at People's Pharmacy.
And we go to the phones. Lynn in Winston-Salem, North Carolina. Welcome to the People's Pharmacy. What is your story, please?
I was recently at a USA Cycling Collegiate event, the National Championship, and a girl crashed right in front of me and hit her head. When questioned, she refused medical therapy, said she'd had 9 concussions, and we told the official that she'd hit her head. She'd had 9 concussions previously. She stopped that race, but then the next day she was right back out there racing. Apparently, whoever medical was cleared her, and I think that's disturbing.
I've got a couple of questions to follow up on that. First of all, are girls more susceptible to concussions than boys?
I think that's a question that I don't really know the answer to from a basic science point of view. Interesting that women's basketball turned up in the last few years as being a strange place for concussions to occur, and there were issues raised about the physiology of a woman's body in development and also in the placement in space, and maybe they're falling differently or they move differently. But I know of no specific risk factor that's gender-based.
Dr. Guskowitz, the idea of wanting to get back in the game, get back on the bike, I bet there's a lot of pressure from players. Oh, come on, coach, put me back in.
Sure, there is, and I think it all comes with education, and I think we're in a better place today than we were even just 10 years ago with the 50 state concussion laws now emphasizing education, no same-day return to play, and a return to play by an allied health care provider with concussion management training. So it's our job really to educate athletes about the dangers of returning to play while still symptomatic.
Well, how long should someone who suffered a concussion, even a mild concussion, rest afterwards?
Well, I tell people that we should not manage concussion with a clock or a calendar, that these things are like snowflakes, as I mentioned earlier, and people are going to respond differently to them. It's really about tracking those symptoms, asking the right questions, giving them the right objective test to ensure that they're back to baseline or back to normal.
Now, we have a personal story to share. Last weekend, our son got married. Wonderful event. Terry's dad was visiting us. Her folks were here, and he slipped, and he fell, and he banged his head. Now he's over 90, and, we were just getting ready for, a big event, and it was like, well, do we need to take him to the hospital?
We helped him up. We put ice on the lump that appeared on the back of his head. He did not lose consciousness, and he said he was fine. And so we took him to the wedding.
The question is,
did we do the wrong thing?
What should a parent, a friend, a relative
or
do?
In this situation, a child, yeah.
What should we do if we're not health professionals and it's not a sporting event and somebody falls? Because I'm guessing, Dr. Finkel, there are far more falls at home than there are injuries.
That's correct.
On the playing field.
That's absolutely correct. And I feel your pain because, again, when something like that happens, there's a lot of people around and you're never really quite sure what to do. And I'm thinking of this more as a parent and a son than I am as a clinician. When you tell that story, what would I do? Because it's the same pressure as the return to play. It's the return to wedding. So
exactly right.
So I think one has to be cautious. and listen. But I don't have specific advice because I think that you've presented one of the toughest situations I can imagine.
Are there any tests that you can do at home?
Right. Again, if we go to the most objective, that person should have a CT scan and make sure they don't have a hemorrhage bleeding into the brain, because that can be asymptomatic. But usually, and again, this is anecdotal and personal, I'm still going to say, are you okay?
Which is what we did.
Which is exactly what we did.
And he seemed okay, and the wedding was great, and he made it back home fine, and so far so good.
The best thing to do is to use Dr. Guskowicz's test and just put him on the floor, put him up on one leg, and see if he falls over. And that's kind of a joke because at a 90-year-old, the balance testing has no norms.
I was going to say, he definitely would have fallen over. One leg, I mean, he had just fallen from two, so that was a problem.
Let's go back to the phones, Terry. We go to Fort Bragg, North Carolina. Mike,
Hi,
we understand you're a paratrooper. Is that right?
Yes, sir.
What's your question or story?
Tell us your story.
In 2012, I received a severe head injury and wasn't diagnosed for about an hour and a half after I returned from the jump. When a soldier looked at me, we finally got back in some light because it was a nighttime jump, and my eyes were to the point where they were shifting back and forth. Everything looked kind of blurry to me, but I didn't realize that I had had a head injury. I actually went to my doctor and said, "Hey, I hit pretty hard, man." And he's like, he looks at me, does a quick field assessment. He's like, "No, you're okay." And then go back, find out that I had a pretty bad head injury. Now, I've had a couple, memory loss, a little bit of memory loss. My cognitive thinking's down a little bit. But my question is, how is the Army going to change the advanced combat helmets that we have to help prevent these kind of injuries?
Dr. Finkel.
Mike, thanks so much, and thank you for your service. The real issue of helmets, I think, was raised by Dr. Guskowicz, and I think all of us recognize that the extraordinary injuries that occur in the garrison, in the military, are difficult to study in civilian practice because very few people jump out of planes, and very few people, even industrial injuries, are exposed to the kind of blast injuries that we've seen in the last decade. So the helmet design, I think, is in a way, like so many things, it's something that's a distraction from the real lessons that you've learned from head injury, which is you want to seek care that's competent, and you want to make sure that any evaluations that are done have good follow-up, and even to the treatment of symptoms if they should last more than usually a month or so.
Dr. Guskowicz, you have been studying helmets for a very long time, in particular football helmets, but what about for a paratrooper or in the military?
Well, I think, and Mike, likewise, I want to thank you for your service. I think recognize that helmet probably did protect you from something more serious possibly happening, skull fracture or brain bleed. But right now we don't have that perfect helmet that's going to do that, as well as manage the energy inside the skull to prevent that sort of shearing of the neurons that I mentioned earlier that when the brain is sloshing around. So we're still working on that. There are a number of different helmet designers out there trying to do this, but right now, jokingly, we say the material that's needed to do what I just described is called inobtainium.
Okay.
But we'll get there, I hope.
Thank you for your call, Mike. You have worked with sensors inside helmets. Can you tell us a little bit about that research?
Sure. So we're working with a company out of New Hampshire, Simbex, that developed this 6 single-axis accelerometer system that's placed inside the helmet. It's linked by way of radio frequency to a sideline computer, and we're able to actually in real time measure the number of impacts a player sustains, the location of that impact, and the magnitude or the severity of it in G's of acceleration.
It's and again, in deference to the trying to understand what's happening in real time, and that's the holy grail. And much of the research money that's being spent across the government agencies and private agency foundations is to try to figure out what to do in the moment. So we would love to have a test that we could test saliva, which may be more efficient than a helmet design, a blood test, or even some of the indirect tests that have been developed for sideline evaluation actually predict whether a person's going to have an outcome.
Very quickly, the difference between a skull fracture and a concussion?
Skull fracture is the breaching of the bone, just like a fracture of your leg. The implications are tremendous if there's if the skull is pushed into the brain, but the skull can crack. And it's difficult to study that because we grade concussions on the basis of things like that. So in the basic science, a skull fracture changes things, but it may have the same outcomes as somebody who has a blow to the head without skull fracture.
Now we have an email from Jeannie who wants to know if trauma to the head can cause complex partial seizures.
I'll take that as the neurologist. In fact, a blow to the head has been associated with immediate onset epilepsy or even delayed onset epilepsy. Again, across populations, difficult to know because so many neurologic conditions, as our very first questioner said, what about something 30 years ago? So if I had a head injury at 15 and I develop partial complex epilepsy, which again is a condition very different from the falling on the ground, frothing at the mouth seizure, it's very subtle oftentimes. I don't think we really know, but there was a wonderful study done looking at biological material in people who had injuries and delayed epilepsy in the military, showing that there's something about folate, which I know your listeners are interested in, vitamin supplements.
Now, one quick question, and that is, if somebody begins to develop cognitive problems and balance issues several days, several weeks, several months after a concussion, is there anything we can do for them?
Well, I think the question would be, I'd want to know more about the history. Is this a delayed onset where things had resolved and then they've resurfaced? I'd be concerned about that and try to better understand and sort through what the source of the problem is.
And as time passes from the time of injury, some of the things, again, that Dr. Gus was mentioned become extremely important, and they're complex because they involve sleep changes. They involve, what about if a persistent headache is a chronic pain syndrome causing distress? What about if you can't return to work or you can't return to your function in school? So the behavioral changes begin to accumulate as time passes, and that's when they, I think, really do need to see somebody expert in the field who can try to untangle it. Because sometimes it's as simple as just getting somebody's sleep right without using drugs.
And we go to Charleston, South Carolina. Joe, welcome to the People's Pharmacy. Tell us your story, please.
Hi, Joe. Hi, Terry. Yes, it was about 5 years ago. I was exercising, and I was doing dips, and I felt like something popped in my head, and I went to the doctor and got an MRI. They couldn't find anything, and it really freaked me out. And then, so after that, if I strain too hard when I'm exercising, I get a serious migraine, and it lasts for like an hour, and then it goes away, and it's scary, and it just doesn't seem right.
Dr. Finkel, you are our headache expert, so please address Joe's concern.
And again, Joe, thanks for a very important question about, and I'm assuming that this is a dip with a weights, where you're taking a bar. And
is that right, Joe?
Yeah. Well, you actually sit down, you put, it's like a seatbelt that goes over you, and then you push down, so you're not actually like dipping your body. It's more like it's a little station. You sit and you push down, and then the weights go up. It's like a lower chest exercise. And
okay,
of course, this would be something where I think you and I would have to sit down and go through not only the history but examination, because weightlifters' headache is an old, well-known kind of headache where we believe it has something to do with neck. But as we become more and more sophisticated about head injury and also changes like you've described, I would really have to go and do some more advanced testing with an MRI scan. But lots of things can happen, including CSF leaks, which is a break in the system, or even something like a disc popping, which can cause very severe migraine-like headaches.
Joe, it sounds like you need some follow-up. Thank you very much for your call. Bye-bye. Gentlemen, we are almost out of time. I guess the first question I'd like to ask is for a lot of our listeners who are not playing football but are concerned about falls, because that is one of the leading causes of concussion. Is there something that can be done to reduce the risk of falls, especially in older people?
Again, I'll take that at first. So the patient who has just recently had a head injury comes to see me, and on the way out I say, try to avoid head injuries. Well, that's
how helpful is that?
Right. Well, It just means if you live in Buffalo, New York, go out slowly on the ice. But it's a really important question. More important, I think, if somebody has pre-existing neurologic problems, balance problems, or if their exposures to head injuries are more prominent, like, again, somebody working up on ladders. Again, we didn't talk about workers today, but it's a very interesting and important area about safety in the workplace. I don't think we've done a good enough job of addressing that yet.
How about coaches and athletic trainers, Dr. Guskowitz? How can they be encouraged to protect athletes rather than, getting that star player back in the game to win?
Well, I think for coaches, Dr. Finkel mentioned earlier the importance of taking a look at the CDC's website. They have these wonderful toolkits for coaches, parents, athletes that really can help create a foundation and an understanding of how to identify. We don't want coaches diagnosing concussion. We want them just to recognize that there's something not right and that they can help triage and get that individual into the medical system. Athletic trainers are critical, in my opinion. I've said this repeatedly, and I stand behind it, and that is that if a high school, a middle school can't afford to have an athletic trainer available, then they probably shouldn't have a football team. And those individuals are the sort of the front line defense for managing these injuries.
Dr. Guskowitz, what message would you like our listeners to take away from our conversation today?
I think just to recognize that we've learned a lot about concussion over the past 2 decades, but yet there are many more unanswered questions. There's a lot of misinformation about the long-term neurodegenerative changes that can occur. We don't quite yet know what the association is to those repetitive subconcussive hits and what they might mean later. But just be smart. Anything that seems abnormal following a suspected concussion, just go and get the medical care that's needed to diagnose it.
Yeah, I would absolutely agree that just to be aware of the symptoms that are present besides headaches, which would be dizziness, problems with sleep, and changes in personality or irritability.
And Clarence asks, what about nausea?
Nausea is a function of vestibular function and may, again, go with it or may be independent.
That's all the time we have. Thank you so much for listening to the People's Pharmacy. We want to thank Dr. Alan Finkel, co-founder and partner of the Carolina Headache Institute and chairman of the Post-Traumatic Headache Section of the American Headache Society.
That's immediate past chair.
Yes. He's also contractor for the Defense and Brain Injury Center at Fort Bragg, North Carolina.
We also spoke with Dr. Kevin Guskowitz. He's Keenan Distinguished Professor in the Department of Exercise and Sports Science at the University of North Carolina at Chapel Hill, where in January he will become Dean of the College of Arts and Sciences. Dr. Guskowitz is co-director of the Matthew Gefeller Sport-Related Traumatic Brain Injury Research Center and director of the Center for the Study of Retired Athletes. He's served on the NCAA Concussion Committee and the NFL Head, Neck, and Spine Committee.
Sophie Copeland produced today's show and provided technical assistance. Al Wodarski is the engineer.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
If you'd like to order a copy of today's show, a CD, you can call 800-732-2334. Today's show is number 1011.
Next week, we'll be talking with Dr. Clark Elliott, author of The Ghost in My Brain. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks very much for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.